You know, if you or someone you love is taking cholesterol medication, you've probably been bombarded with warnings, rumors, and let's face it, some pretty scary stories about what these drugs do to your body. Well, today we're diving right into this explainer to just cut through all that noise. We're going to build a really clear, easy to understand pyramid of risk directly from the source data. We'll start right at the broad base of common everyday symptoms and work our way all the way up to that narrow tip of rare, severe complications. So, here is our agenda for today. We've got the statin mechanism, who is most at risk, common side effects, uncommon and reversible effects, and finally, those rare and severe risks. Let's get to it. Starting off with Section 1, the statin mechanism. Okay, before we can really understand the side effects, we have to look under the hood at the underlying machinery. What are medications like atorvastatin or simvastatin actually doing once you swallow that pill? Well, statins are highly targeted disruptors. Once one enters your system, it zeroes in on a very specific rate-limiting step, effectively blocking what's called the HMG-CoA reductase enzyme. You can kind of think of this enzyme as the main foreman at your body's cholesterol manufacturing plant. By inhibiting that foreman, statins stop cholesterol production right at the source. But because this biological pathway is being artificially blocked, it can trigger a whole ripple effect of side effects throughout the body.
Moving right along to Section 2, who is most at risk?
So who is actually most likely to experience these ripple effects? Well, the risk definitely isn't equal across the board. Certain baseline patient characteristics significantly bump up your chances of having side effects. Your overall baseline health plays a massive role here. For instance, being female or being over 80 years old automatically puts you in a higher risk bracket. It's also heavily dependent on your body's filtration and metabolic systems. So pre-existing kidney disease, liver disease, or having a low-functioning thyroid, those drive your risk up too. And if you add in lifestyle factors like heavy alcohol consumption or the sheer burden of taking multiple cholesterol medications all at once, you're laying the foundation for a much higher probability of running into these side effects. That brings us to Section 3, common side effects. Now we've reached the broad base of our risk pyramid, starting with what you might actually feel in your muscles. If you read the medical literature, you're going to see the clinical jargon myalgia thrown around a lot. This literally just means muscle pain, encompassing those pervasive, all-over aches and specific areas of tenderness. And what's absolutely vital to know here is that myalgia is dose-dependent. Basically, the higher the statin dose you're prescribed, the more likely and more severe these muscle aches are going to be. But wait, we need to make a really important medical distinction here. It is crucial to separate myalgia, which again is just the sensation of pain, from myopathy. Myopathy indicates an actual disease state in the muscle itself. While both can happen, understanding the difference between just feeling sore and having actual muscle tissue disease is key when you're communicating with your doctor. What's truly staggering about this is just the sheer volume of people affected. The data suggests that upwards of 20 to 50% of patients are going to experience these muscle aches. That means if you line up two people taking a statin, it's essentially a coin toss whether one of them will deal with this. It's incredibly common, and it forms the absolute foundation of our risk pyramid. Moving slightly up our pyramid, we hit headaches. And these are arguably just as common as muscle pain with statins. In fact, statins can sometimes trigger severe migraine headaches in susceptible people. But the research presents this fascinating paradox that poses a really interesting question. Can statins actually cure the very headaches they're known to cause? Amazingly enough, the answer might actually be yes, under the right conditions. Some evidence shows that when statins are used alongside vitamin D supplementation, they might reverse course and actually reduce those severe headache symptoms. It really suggests there might be a massive difference in a patient's side effect profile just depending on their underlying vitamin D levels. It's a pretty wonderful example of exactly how complex pharmacology can be. All right, on to Section 4, uncommon and reversible effects. As we move higher up our pyramid, the air gets a bit thinner. We start finding side effects that are less common, often a bit surprising, but thankfully highly reversible. For example, one of the most frightening things you can experience on a new medication is cognitive decline. Some patients report memory issues or just a general brain fog. But the incredibly reassuring takeaway here, these cognitive problems completely resolve as soon as the statin is stopped. It's a temporary chemical roadblock, not permanent damage. And here's a crucial reality check that I honestly find quite funny in a clinical sense. Patients regularly report changes in their bowel habits on statins, alternating between constipation and diarrhea. But get this, clinical trials show that placebos cause the exact same rates of these side effects. So in this specific case, it might not be the chemical statin itself messing with your stomach, it might literally just be the psychological reality of taking a new daily pill. Now, a very real metabolic change involves your blood sugar. For folks with type 2 diabetes, or even those at risk of it, statins can actually increase your blood glucose levels. The underlying mechanism here is that statins can trigger a specific immune response that actively depresses how well your body's insulin functions. So it's an uncommon effect for sure, but a super important one for diabetic patients to monitor closely with their doctors. Rounding out this tier of the pyramid, we also occasionally see fatigue, and this is deeply linked to that muscle weakness we talked about earlier. I mean, if your muscles ache, your whole body is going to feel tired. Rarely, patients experience insomnia, which is particularly fascinating. It seems to happen a lot more with fat-soluble versions of the drug like simvastatin and atorvastatin. Why? Because their fat solubility actually allows them to cross the blood-brain barrier much more easily, which can potentially disrupt your sleep architecture. Finally, you might experience pre-syncope, which is just the fancy clinical term for a sudden sensation of lightheadedness or feeling dizzy. Next up, Section 5, Rare and Severe Risks. Finally, we have reached the very tip of our risk pyramid to look at the rare, severe complications that absolutely require immediate medical attention. Remember that common muscle ache, myalgia, from the base of the pyramid? Well, at the extreme rare end of that exact same spectrum sits rhabdomyolysis. This is a severe breakdown of the actual muscle tissue itself. And when muscle breaks down violently like this, it releases a protein called creatine kinase right into the blood, which you can track on lab work. If it's left untreated, all this cellular debris flowing through your bloodstream can severely damage your kidneys. Another severe risk at the top of our pyramid here is hepatitis, which simply means liver inflammation. When the liver becomes damaged by the statin, liver enzymes called transaminases essentially leak out into the blood. This creates some very distinct symptoms. Patients will often feel pain or tenderness in their right upper quadrant, which is exactly where your liver sits tucked under your ribs. In severe cases, this liver damage causes jaundice, leading to yellowing of the skin and what's known as scleral icterus. That's the stark yellowing of the whites of your eyes. You might also hear a term called thrombocytopenia. That's the clinical term for a dangerously low platelet count in your blood. Our source data notes this has been found in a few severe case reports that were specifically tied to atorvastatin use. Though I have to emphasize, it remains an exceptionally rare event. And speaking of rarity, only about 1% of statin users experience hair loss. I'm bringing this statistic up just to perfectly anchor how uncommon the symptoms at the top of this pyramid truly are. We spend so much time worrying about the absolute scariest potential outcomes of a medication, but statistically speaking, they affect a tiny fraction of the population. So, I want to leave you with this final thought. Human beings are notoriously bad at judging risk when everything is just presented to them as a flat list of potential side effects on a warning label. But now that we've built this pyramid together and you can separate the 50% chance of a mild muscle ache from the 1% chance of hair loss or the even rarer chance of liver issues, well, are you better equipped to take charge of your cardiovascular health? Because when you can visualize the data this clearly, a complex medical decision suddenly becomes a much more rational, manageable conversation between you and your doctor.